Throughout the anesthesia documentation process, all of the medications administered must be documented on the patient's anesthesia record. All of the medication details will be made available to you in one location to allow automatic tracking. There are two methods that can be used to document medication administration. We will start by reviewing the Medications button on the toolbar. This will launch a new window to select your medication. The top portion of this window defaults to a new medication administration. This tool is also very effective to review all medications that have been documented on a procedure for either modification or removal. The next section is divided into medication categories that are based on standard classifications. By selecting the medications category, you will see different concentration selections that are available at your facility in the window below. For this example, we will choose the cardiovascular drug category. Notice that your drug may appear multiple times, and you must pay close attention to selecting the correct concentration. For this example, we will select atropine 0.4 milligrams per milliliter. When you click on any medication, it will open the detail box to be completed and executed. At the top of this box, you will find the medication you selected. Next, you will see that this is a bolus or IV push selection defaulted for this type of medication. If this was an infusion, the system would default to the radio button for infusion to be selected. Next to these selections, you will find the concentration. This area is one that you typically will not need to modify at any time. Below this, you will see the same time selection graph that is available on other documentation actions. By selecting the white dot, you can change your administration time by dragging it to the correct spot. Note that you cannot pre-chart medications in this system. Another option for selecting the time to administer is seen below this. You can type in the time or use the arrows to alter your time. Most medications will contain the following three fields: dose amount, volume, and weight-based dose. Note that the field that has been defaulted for immediate entry is dose amount. By typing on your keyboard or selecting the dose in the keypad to the right, the three columns are populated with the correct information. The last few options are seen at the bottom of this screen. The route is defaulted for the most often used, in this case IV. The site is not a required field, but has a standard list of options you can choose from to indicate where the drug was given. Lastly, you can add comments as desired to any administration for clarity. By selecting OK, the medication will be documented. Now that we have a medication documented, let's review how this appears on our charting timeline. Above the gases and monitors section, you will now see the medication administration appears as a single line item. If you carefully hover over the colored dot, you will be able to see the details of the administration. You can also document a second administration of the medication by right-clicking on the medication name and choosing Add Administration. The same box appears and defaults to the current time and the last dose charted. Choose OK, and another administration appears on the timeline. The last process for manually documenting a medication administration outside of the to-do list is by using the Toolbox. This area is found at the lower left-hand corner of the application. Choose the Medications tab on the left, and similarly you can select the drug category. This time we will choose Induction, and move down the list to find propofol 10 milligrams per milliliter. From this point, we have an option of adding the drug to the to-do list by dragging and dropping, or by double-clicking for immediate administration. The same medication administration box will appear. Let's choose to give 20 milligrams IV push of propofol and leave the default to now. Choose OK or hit Enter. We will again see the propofol has been added to the event timeline. Our next step will be to modify administrations. Let's start by modifying our first dose of atropine and changing the time. This can be done through either the toolbar Medications button or by right-clicking on the medication in the timeline. You will find that for a short case, right-clicking on the drug is the fastest option. However, as you extend your cases to longer times and more drugs are given, using the Medications button will provide easier access to finding the drug administrations. Let's start by using the toolbar. After launching the Select Medication window, change the selection to Modify Admin. You will now see the list of drugs that have been given to the patient. You can choose atropine, and the list of administrations appears if there are multiple. Select the correct administration and choose OK. Now you are able to modify any details of a medication administration as needed. The second option is to hover your mouse over the colored dot of an administration and right-click. You can now choose to modify administration and make the changes in the same manner. To remove an administration, follow the same process as modification. You will be prompted with a question to confirm you intend to remove the administration. Finally, let's discuss an infusion. Infusions fall into different categories within the anesthesia application, but all are documented in nearly an identical fashion. Drug infusions, blood products, colloids, crystalloids, or other intake, such as TPN. First, let's demonstrate an amiodarone drug infusion. This time we will document the medication from the medication toolbox. Select cardiovascular and choose amiodarone 450 milligrams in 250 milliliters. This drug has been defaulted incorrectly as a bolus drug. To change this, click on the infusion radio button. Next, let's move down to the dose. I typically infuse amiodarone based on milligrams per minute, not hour. I have the option to click on the blue text and make this change to my preference. Now I will choose 1 milligram per minute, and the documentation follows. All other fields are the same except the administration timeline. Here you will note that the infusions are set up with a green bar and a yellow line fading out. The green bar indicates the start time, and the yellow bar indicates the drug is still infusing. Let's backdate this. On the timeline, you will now see the amiodarone infusion clearly with the line indicating it has continuously infused and at the current rate. By right-clicking on the orange line and choosing Change Administration, we can alter the rate and clearly show the time of the decrementation. Lastly, we can stop our infusion at any time by right-clicking and choosing Stop. A red bar appears indicating that this has been stopped. You have now learned all the basic steps to administering medications in the anesthesia application.